Welcome to the Turning 65 Medicare Educational Seminar. If you or a family member has had a 65th birthday this year or will have a 65th birthday this year, then happy birthday! This Medicare Educational Seminar is designed to review 2012 Medicare, the Part D prescription drug program, and the types of Medicare health plan options. This seminar does not cover specific health plans or their member benefits. Medicare has not reviewed or approved this presentation. Medicare does not review educational seminars. The Turning 65 Medicare Educational Seminar has been reviewed and approved by several health plan CMS compliance officers. There is an audio feature to this presentation which you can activate or mute. Also, there is a Contact Me feature on this website where you can send us your questions about Medicare and request help with your Medicare. Thank you, and enjoy the Turning 65 Medicare Educational Seminar. The Turning 65 Medicare Educational Seminar will take you through these aspects of Medicare. The baby boomer generation turning 65 in the next 10 years. The Medicare program. Your Medicare health plan options. A review of Part D prescription drug benefit. When you can enroll in Medicare and Part D. Your resources to gain more information about Medicare, Social Security, and Medicaid. Hopefully you will come away from the Turning 65 Medicare Educational Seminar with a better understanding of the basics of Medicare. Individuals turning 65 this year are members of what is referred to as the baby boomer generation. Over the next 10 years, enrollment into Medicare will skyrocket to 75 million members. Over 10,000 baby boomers turn 65 every day. That is almost 4 million new Medicare members this year. In California alone, over 400,000 seniors turn 65 each year, with 250,000 turning 65 in Southern California. More than 25% of the baby boomers plan to delay retirement and work beyond the age of 67 to maximize their Social Security retirement fund. Now let us review what Medicare is all about. Medicare and Social Security are two different federal entitlement programs with different eligibility dates. Medicare and Social Security interlock when you sign up for Part B Medicare and pay the monthly Part B premium through your Social Security check. You must contact Social Security to subscribe to Medicare. You can start your Social Security retirement benefits as early as age 62 or as late as age 70. The longer you wait to join Social Security, the higher your benefit. If you were born in 1960, at age 67, you will achieve full retirement age to start Social Security and receive 100% of your Social Security benefit. Medicare begins at age 65. You can join Medicare at age 65 or later when you retire and voluntarily terminate your employer's health insurance, or involuntarily, you lose your employer's health insurance coverage. After 24 months of Social Security-approved disability, you can become eligible for Medicare. Now is the time to start thinking about when you plan to start Social Security and Medicare. Medicare was established in 1965. Medicare is a federal health insurance program and is designed for the aged and disabled. To qualify for Medicare, you must be a U.S. citizen or resident visa and in the United States for 5 consecutive years. You must be 65 or older or getting disability benefits for 24 months, or have kidney failure or end-stage renal disease, or approved Social Security disability with a diagnosis of ALS, Lou Gehrig's disease. The federal agency, Centers for Medicare and Medicaid Services, administers Medicare, as well as the Medicaid program. Medicare gives letters to its types of health coverage. Part A is your hospital coverage, inpatient services, and skilled nursing facilities. Part B is your medical coverage, doctor, lab, outpatient services, supplies. Part C is the Medicare Advantage plans available to you. These plans cover the Medicare benefits under Part A and Part B. Many of the Medicare Advantage plans also cover Part D, prescription drug coverage. Part D is your prescription drug coverage. We will cover in detail Part A, Part B, Part C, and Part D, so you have a thorough understanding of these components of Medicare. Medicare has exclusions and limitations you need to be aware of. No coverage outside the United States. No coverage for routine vision, dental, hearing, and podiatry. No coverage for acupuncture, hearing aids, or dentures. No custodial care or nursing home care. Medicare has deductibles, coinsurance, and a Part B premium. Because Medicare does not cover all your health needs, there are financial risks associated with Medicare. If you elect to only have Original Medicare as your health insurance, you should purchase a Part D standalone prescription drug plan. The standalone prescription drug plan will have a cost associated with the plan. There can be a penalty if you do not elect to purchase a Part D prescription drug plan. What are some of the out-of-pocket health expenses you could incur because they are not covered by Medicare? There are in-home custodial care costs to have a caregiver help you with your daily living activities, such as cooking, cleaning, and bathing. There are nursing home care costs. To qualify for Medicaid to cover your nursing home care, you must spend down your assets and have limited income. Medicare does not cover dental expenses, crowns, dentures, implants. For 2012, after exceeding your initial prescription drug benefit of $2,930, members are responsible for out-of-pocket expenses called the gap or donut hole, which amounts up to $4,700. Medicare has an initial hospital deductible of $1,156 and has copayments after you are in the hospital for 60 days. Certain Medicare Advantage health plans also have hospital copayments. Medicare Part B has a $140 annual deductible plus 20% coinsurance for physician and medical services. Medicare Advantage health plans may charge copayments for primary and specialist office visits. Some Medicare supplement plans have physician office copays. When you sign up for Medicare, you will get a Medicare card that looks like the one on this slide. A couple of important points you need to know about your Medicare card. 1. Your name as printed on your Medicare card must be used exactly on any document that asks for your name on your Medicare card. For example, the card on the slide has Jane Doe as the name. If Jane Doe was to complete a document which asks for her name on her Medicare card, she must put Jane Doe, not Jane R. Doe, adding a middle initial, or Jamie Doe, her nickname, or even Jane Smith, if she got married but did not inform Social Security to get a new card with her new name. 2. Your Medicare claim number may or may not look similar to your Social Security number or that of your spouse. If married and you did not pay into Medicare working 40 quarters, you could be covered by your spouse if they worked 40 quarters and paid into Medicare. Your Medicare claim number would be that of your spouse with the letter B following the number. Be aware, there are a lot of variations of the Medicare claim number. If you have questions about your number, you can call Social Security or Medicare. As indicated on the previous slide, Part A eligibility is for people aged 65 or older, their spouse, who paid Medicare payroll taxes for 40 working quarters. The 40 working quarters do not have to be consecutive quarters, just 40 quarters during your working years. Part A eligibility for those under age 65 if disabled for 24 consecutive months. For those of you who did not pay Medicare payroll taxes for 40 quarters and wish to purchase Part A coverage, you can purchase Part A coverage. In 2012, Part A monthly premium would be $248 for those who paid Medicare taxes for 30 to 39 quarters. You would pay a monthly premium of $451 if you had less than 30 quarters. Because of income and assets, some individuals could have their Part A premium subsidized by a federal program named Qualified Medicare Beneficiary, or QMB. Part A Medicare benefits include hospital coverage for 90 days per benefit period, plus 60 lifetime reserve days of hospital coverage past day 90. Inpatient psychiatric care up to 190 lifetime days. Skilled nursing facility coverage up to 100 days per benefit period, only after 3 days of hospitalization. Home health care, not to be confused with custodial care. Home health care is medically prescribed home care by your doctor, for example, physical therapy in your home. Hospice care, which is end-of-life care. A benefit period is defined by Medicare as a benefit period begins the day you go into the hospital or skilled nursing facility. The benefit period ends when you have not received any inpatient hospital or skilled nursing facility care for 60 days in a row. If you go into a hospital or skilled nursing facility on day 61 or more, a new benefit period starts. You would be responsible for the inpatient hospital deductible for each new benefit period. There is no limit to the number of benefit periods. Benefit periods are not on a calendar year. In 2012, Medicare has a Part A $1,156 deductible per benefit period. That means when you check into the hospital, you are responsible for the $1,156. After the deductible, for each day you are in the hospital per benefit period from 1 to 60 days, the coinsurance is $0. For days 61 through 90, the coinsurance is $289 per day, and for days 91 through 150 days, the coinsurance is $578 per day. For example, if you are in the hospital for 90 days, you would be responsible for the first $1,156 deductible and 30 days of coinsurance at $289 per day. Remember, the first 60 days of the 90 days, there is no coinsurance. Therefore, you would be responsible for $9,826 for the 90 days you would be in the hospital. For stays in a skilled nursing facility, there is no coinsurance for the first 20 days, but from days 21 through 100, there is coinsurance of $141.50 per day. At age 65, if you elect to join Medicare and subscribe to Part B, your Part B premium is deducted from your Social Security check. If you have delayed taking Social Security, then you will mail your premium to them each quarter. Unless you are covered by other health insurance, for example insurance from your employer, at age 65, if you elect Part B, you have 63 days to sign up for Part B. If you do not sign up for Part B within the 63 days, then you have to wait until the Part B general enrollment period, January to March, with a July 1st effective date. You will also be responsible for a penalty for not signing up for Part B within the 63 days. Part B benefits covers the following services: physician services, outpatient hospital services, clinical lab, ambulance, diagnostic tests, X-rays, MRIs, CAT scans, medical equipment, eyeglasses after cataract surgery. In 2012, there is a $140 annual deductible for Part B services, plus 20% of the Medicare-approved amount for services. Your Part B premium is based on your adjusted gross income. In 2012, Individuals earning less than $85,000 adjusted gross income or $170,000 adjusted gross income for married, their individual Part B premium is $99.90. You can see by the chart that the individual Part B premium rises with the increase in adjusted gross income. An individual with a $214,000 adjusted gross income or a married couple with $428,000 adjusted gross income each would pay a monthly Part B premium of $319.70. Each year, Medicare will evaluate past tax returns for those on Medicare to determine the adjusted gross income to establish their Part B premium for the current year. Increases or decreases in the adjusted gross income result in an increase or decrease in Part B premium for the current year. Part C refers to joining a Medicare Advantage health plan. To enroll in a Medicare Advantage health plan, you must be enrolled in Part A and Part B and reside in the Medicare Advantage health plan service area. Benefit coverage in a Medicare Advantage health plan must be actuarially equivalent or better than coverage under Medicare Parts A and B. Medicare Advantage health plans may include benefits not covered by Medicare Parts A and B. Medicare Advantage health plans may include Part D prescription drug plans. Medicare supplement plans are not covered under Part C and will be covered later in this seminar. There are several names of Part C health plans you should be aware of, especially their acronyms. Health Maintenance Organization, HMO. Medicare Advantage plan with Part D, MAPD, includes Part D prescription drug benefits. Medicare Advantage only, MA, lacks Part D prescription drug benefits. Medicare Preferred Provider Organization, PPO plan. Some PPO plans also include Part D prescription drug benefits. Medicare Private Fee for Service, PFFS plan. Some PFFS plans also include Part D prescription drug benefits. Medicare Special Needs Plan, SNP. Special needs plans always include Part D prescription drug benefits. Medicare Medical Savings Account, MSA plan. This plan combines a high-deductible Medicare Advantage plan and a bank account. The plan deposits money from Medicare into an account. Member uses it to pay expenses until deductible is met. This Medicare Supplement Insurance Benefit Chart details each lettered Medicare Supplement plan and its respective coverage of Medicare's deductibles, coinsurance, and copayments. As you can see from the chart, none of the plans cover Part D prescription drugs. If you want drug coverage with a Medicare Supplement plan, you must also purchase a standalone prescription drug plan. Plan F covers 100% of all Medicare deductibles, coinsurance, and copayments. Plan F with a high deductible is available from some insurance companies. The high deductible Plan F is significantly lower in price than Plan F without a high deductible. Plans M and N with coinsurance and copayments are generally priced competitive with other plans. Beginning in the latter half of 2010, preventative care and hospice was added as a covered benefit by all the Medicare supplement plans. Value-added benefits, such as wellness benefits, are not included on the chart, as each insurance company has the latitude to provide these benefits on a plan basis. Before purchasing a Medicare supplement plan, check with the insurance company as to the value-added benefits available to you. When you join Medicare, besides Original Medicare, you have the option to select a Medicare supplement plan or a Medicare Advantage plan. Outlined are some of the key considerations in selecting the type of plan best for you. 1. A Medicare supplement plan has limited guaranteed issue options, and availability may be based on your health history. A Medicare Advantage plan with prescription drug coverage, MAPD, is guaranteed issue except for end-stage renal disease. 2. With a supplement plan, you have direct access to specialists, while MAPD plans, you must select a PCP, get a referral for a specialist visit, and you must stay within the designated provider network. 3. Supplement plans have a monthly premium based on your age, plan selection, and your county of residence. Your monthly premium increases over time. MAPD plans have no or low premiums, which vary by county. 4. Supplement plans have copays based on plan selection, while MAPD plans have no or low copays, but the MAPD plans could have coinsurance for services such as radiation therapy. 5. For prescription drug coverage, with supplement plans, you must purchase a standalone prescription drug plan. With MAPD plans, prescription drug coverage is included in the plan. Copays for drugs vary by MAPD plan. Coverage in the gap or donut hole also vary by MAPD plan. 6. Generally, supplement plans have no or limited value-added services. You must purchase a dental and vision plan for coverage. For no or low premiums, MAPD plans do include value-added benefits such as wellness, fitness, dental, and vision. 7. If you travel outside of the United States for emergency coverage with supplement plans, you must purchase a plan with foreign travel coverage. With MAPD plans, urgent and emergency coverage is provided for foreign travel. Coverage limits vary by health plan. Part D, or prescription drug coverage, was established in 2003 by the Medicare Modernization Act. To be eligible for Part D, you must be enrolled in Part A or Part B, or both. Medicare does not administer Part D benefits. The health plan offers Part D prescription benefits either through a Medicare Advantage plan, termed Medicare Advantage Prescription Drugs, MAPD, or the health plans offer standalone Part D prescription drug plans for purchase. You must select Part D coverage when first eligible for Part B, or you will pay a penalty when you do elect Part D coverage. The penalty is based on the national average of Part D premiums. For 2012, that is $38. Dual-eligible members are auto-assigned their Part D coverage if they are on straight Medicare and Medicaid and not on a Medicare Advantage plan with prescription drugs. Subscribing to Part D coverage is voluntary, except for those who have both Medicare and Medicaid coverage. These individuals are auto-assigned by their state a prescription drug plan. Even though voluntary, you will pay a penalty of 1% of the $38 national standard premium for every month you could have had Part D coverage but chose not to enroll. If you have credible prescription drug coverage through your employer's health plan or through the VA, then you do not have to enroll in a Part D plan. If you are on a Part D prescription drug plan and wish to change to another plan, the Part D open enrollment is October 15th to December 7th. You may not enroll in two Medicare-certified Part D plans at the same time. For example, if you are on an MAPD plan that includes Part D prescription drugs, you cannot enroll in a standalone Part D prescription drug plan. If you do enroll in the standalone plan, Medicare will disenroll you from your MAPD plan and put you on straight Medicare with your standalone plan. All Part D plans must be minimally actuarially equivalent. In other words, they all must have the same basic benefits as required by Centers of Medicare and Medicaid services. The monthly premium vary by Part D drug plans. Based on your adjusted gross income, you could pay an additional amount over the plan premium. The annual deductible, if applicable by the drug plan provider, cannot be more than $320. For 2012, the initial coverage limit or benefit for drugs is $2,930. The enrollee's out-of-pocket cost threshold in the GAP or donut hole is $4,700. In 2012, you receive a 14% discount on generic drugs when you are in the GAP. You may also receive a 50% discount on brand drugs in the GAP if the provider of the brand drug you are taking participates with the GAP program of discounting on their brand drugs. The enrollee's cost share above the threshold, also termed catastrophic coverage, is $2.60 for generic or preferred multi-source drugs, $6.50 for all other drugs, or 5% of the drug cost, whichever cost is greater. Part D income-based premium is based on adjusted gross income, single or married. In 2012, individuals with less than $85,000 adjusted gross income for individual or $170,000 adjusted gross income for married, their individual Part D premium is $0. You can see by the chart that the individual Part B premium rises with the increase in adjusted gross income. An individual with an $85,001 premium or married and $170,001 of adjusted gross income, they would pay a monthly Part D premium of $11.60. Each year, Medicare will evaluate past tax returns for those on Medicare to determine the adjusted gross income to establish their Part D premium for the current year. Increases or decreases in the adjusted gross income result in an increase or decrease in Part D premium for the current year. You must know some prescription drug terms when subscribing to a Part D prescription drug plan. 1. Formulary. This is the health plan's or Part D provider's printed listing of Medicare-approved drugs they cover. Health plans must cover the basic Medicare-approved drug list, but may cover more. The prescriptions for drugs listed in a health plan's formulary must be filled at the health plan's contracted pharmacy network. 2. Step therapy. In some cases, health plans require a member to first try a more cost-effective alternative drug for a period of time before being stepped up to the more expensive drug. 3. Prior authorization. In some cases, for a specific drug, health plans may require the physician to get approval from the health plan to write a prescription for the specific drug. There are definite rules when you can enroll in Medicare Part A and Part B and Part D, a prescription drug plan. These enrollment periods are termed Initial Coverage Election Period, ICEP, and Part D Initial Election Period, IEP. Additionally, each year, CMS establishes the dates that Medicare beneficiaries can change health plans. This period is termed Annual Election Period, or AEP. Medicare members can disenroll from their health plan during the annual disenrollment period. There are special circumstances during the year that Medicare members can change health plans. This is termed Special Election Period, or SEP. Your initial enrollment into Medicare Part A and Part B is termed Initial Coverage Election Period, or ICEP. This ICEP begins 3 months before your 65th birthday, includes the month of your birthday, and extends 3 months after your 65th birthday. If you elect not to sign up for Medicare when you turn 65 because you have credible coverage through your employer, union, or VA, then when you do sign up for Medicare, your timeline to complete your enrollment is different than your initial coverage election period. You have only 63 days to enroll into Medicare after losing your credible coverage, or you will pay a 1% penalty of your Part B premium for every year you did not enroll in Medicare Part B. If you have credible coverage through your employer group, union, or VA, Part B enroll can be pended beyond your initial month of eligibility. Part D Initial Election Period, IEP. For those who are newly eligible for Medicare's Part D prescription drug coverage, the initial election of Part D occurs simultaneously with ICEP. Only one Part D enrollment choice can be made, either a standalone prescription drug plan or one included by enrolling in an MAPD plan. Those eligible for Medicare prior to age 65 will have another ICEP when attaining age 65. The 2012 Annual Election Period, AEP, is available to all Medicare, Medicare Supplement, Medicare Advantage, and Part D eligible beneficiaries. The annual election period for a 2012 January 1st effective date began October 15th and ended December 7th of 2011. The dates for AEP for 2012 will be announced by CMS later in 2012. During AEP, beneficiaries can stay with their current Medicare plan, or they can add or drop their Medicare Advantage plan and/or drug coverage plan, or return to original Medicare. Generally, the effective date of coverage will be January 1st, 2012. The 2012 annual disenrollment period is January 1st to February 14th, 2012, where Part C beneficiaries can disenroll from their MAPD plans and return to original Medicare, and may enroll in a prescription drug plan during that same period. A Special Enrollment Period, or SEP, is for Medicare beneficiaries experiencing unique qualifying events, such as involuntary loss of their employer health benefits or moving to an area where your current Medicare health plan is not available. During SEP, you have one opportunity to change to a Medicare Advantage plan or Part D plan. Those with dual eligibility for Medicare and Medicaid can enroll any time during the year, as can those with a low-income subsidy. Medicare has excellent resources for information about Medicare. You can go to the Medicare website at www.medicare.gov or call Medicare at 1-800-MEDICARE. For help with Social Security, you can go online at www.ssa.gov or call Social Security at 1-800-772-1213. TTY users should call 1-800-325-0778. For questions about Medi-Cal, their website is www.medi-cal.ca.gov or call 1-800-541-5555.